Thank you for having me here today. I'd like to thank the association for giving us a chance to present ourselves and also to acknowledge the fact that all of you all are the first primary contact for so many patients and filter out all of them before they reach us. And I should applaud you for all the hard work you do. Thank you so much. So, I'm not going to take more than about 10 minutes. I'm just going to go through basics of care of normal newborn. So I'm just going to give you a little snapshot of how we manage normal newborn babies in our center. What is a normal newborn? A newborn who is full-term vertex presentation, born after completed 37 weeks of gestation, who's at least 2.5 kgs at birth, is what is called as a normal newborn. Whenever a normal newborn is born in our center, it's all attended by pediatricians who are well qualified and their consultants depending on the risk of the delivery. And most of these babies who just come out, cry, and don't require much to do. But if they do require any resuscitation, we go through the neonatal resuscitation program, which is the Indian NRP, and then we resuscitate them appropriately. After a full resuscitation, they undergo a full checkup, which includes their vitals, their heart rate, their respiratory rate, their temperatures, their blood pressures, their pulses, weight of the baby. We check for a full anthropometry and we do a full general physical examination right from head to toe to check for the brain, to check for the cranial sutures, to check for the cranial structures right from the neck, chest, thorax, back, abdomen, limbs, and the umbilical cord. And we assess for the systems wherein we look at the breathing, the cardiovascular activity of the baby, the temperatures, and then we classify them whether they should be fit enough to go back to mom or they require an NICU care if so. And levels of NICU care, I don't want to go into detail, but we have 3 levels of NICU care. The basic level where the baby is not requiring any oxygen, level 2 where the baby is requiring some oxygen in form of pressure like CPAP or high flow oxygen, and 3 where the baby is requiring any ventilation. We aim to breastfeed babies within half an hour of birth. So much so that it might be delayed sometimes during cesarean sections, but most of the babies who've had normal deliveries immediately go on to skin care for an immediate colostrum feed and then continue feeding with mom. And we are happy to say that we've got almost 10% breastfeeding rates in our center. And then after the baby goes on to the mother's side, then the baby is assessed postnatally by our junior doctors as well as nurses for their feeding ability. We've got a lactation consultant who comes in who gives them a full idea of how to do lactation and what are the best positions and what are the challenges which they can endure and how to go about it. And then after about first 24 hours of these children, they undergo a bath, and we have to understand that all babies have a little white covering on their body called as vernix caseosa, which is excellent thermoregulator of the body and helps in conserving the body temperatures. So we only allow that to follow usually, and we do a very gentle sponge bath after a day, and then we do the vaccinations. After 24 hours, most of these babies undergo an eye checkup to check for ret reflex and ear checkup to check for hearing, and we do a hip examination if in case they are breech, or a hip scan if in case necessary. And the vaccination is done between 24 to 48 hours. Most of these babies before they go home have a newborn screening checkup which happens between 24 to 48 hours of life, wherein we look at 8 common disorders and thyroid most importantly. And just an important thing wherein I'm not going to go into too much details, but just to know that umbilical cord which is present on the babies generally falls off by 7 to 10 days. And if it doesn't fall off by about 14 days, you'll always have to check for immunological disorders, and otherwise just local antisepsis really helps. Care of eyes, we just clean their eyes with basic cotton swabs and make sure that the parents are counseled that they should not be applying anything in and around the eyes, and eye drops only if the eyes are sticky. And we all know that in all babies, the general newborn care includes making sure that the dressing is nice and loose, good soft cotton clothing, not use of too many baby products products like moisturizers, anything of that sort. Only if necessary, they should be consulting doctors before using. No plastic nappies. Ideally, we'd like to say that you use cloth nappies or the other nappies, but making sure that the nappy care is taken care of. And a vaccination, regular vaccination and follow-up vaccinations thereafter. And what are the danger signs? So once the baby goes back home at around 48 to 72 hours of life, depending on mother's discharge and how the baby's bloods come back at 48 hours, the babies are told a specific, the mothers or the parents are told a specific set of danger signs which comes into all our discharge summaries, which includes bleeding from any side. The baby's got any large amount of epistaxis, hematomesis, any bleeding in the motion of the urine area. It's very common. Girls, very common to have little bit of reddish nappy the first week of life. It's again very hormonal, nothing to worry. Jaundice, of course, we know that jaundice is a very common thing postnatally. It's commonly present in the first 7 to 10 days, almost increases up to second week, starts coming down thereafter. And it's a bit delayed, the coming down thereafter is a bit delayed in preterm babies, can go up to 3 weeks also. But any jaundice which is significantly yellow, staining the palms and soles of the baby is not happy, not comfortable, not feeling well, lethargic, or either crying a lot but not latching very well. Such jaundices needs to be checked by a neonatologist preferably and needs to be treated immediately. Not passing stool in the first 24 or urine in the first 48 hours. Again, that's a very important thing because we need to rule out any issues with regards to the urine passage or the passage of the meconium. Most likely babies in the first 2-3 days pass about 1 to 2 times urine, second, third, fourth day 2 to 3 times, by 7th day 4 to 5 times, by 10th to 14th day much more than that, and good heavy wet nappies. It all depends on mother's milk output also by that point of time. Any poor feeding, lethargy is a very important sign in babies, because the first thing they lose if they are not comfortable is a lethargic, poor feeding baby who doesn't seem to be latching on very well. Apneas, that is not breathing and becoming blue. Excessive crying, not consoling. Most common 3 reasons in babies could be hunger, a wet nappy, or an abnormal temperature. Either the baby is too hot or too cold, excessively wrapped or not wrapped at all. So one of the 3 common causes why they cry. Seizures, of course. Seizures are very uncommon, but of course they can present in varied ways. But seizures are something which you should notice. And cyanosis and difficulty in breathing. We start all babies on multivitamin supplements, calcium, iron, depending on case-to-case basis. Preterms generally get calcium, multivitamins. The terms get just a plain vitamin D3, which continues for first year of life. Common newborn problems. I don't want to go into too much detail, but vomiting very common first 24 hours. Generally settles down. Constipation very common in babies. They come saying 2-3 days not past urine, not past motion, but then passing gas. And otherwise a comfortable baby who's latching on very well. So then you just wait and see. Alright, very important to rule out thyroid levels in such babies who are constipated. Diarrhea, very common. Babies come with large, sometimes little watery stools. And most common reason is the fore-milk, hind-milk intolerance, wherein you tell the mothers to completely finish emptying one side of the breast before going on to the other side. They're doing half and half, very common reason to have little bit of wet nappies. Jaundice, like I said, it's very abnormal in the first 24 hours, increases back to second week, then comes down. But if it's very high, staining palms and soles, please refer them to the nearest neonatologist. Ideally, we would be able to manage such cases. Hiccups, sneezing, very common in babies, nothing to do, normal physiological. Dehydration, of course, babies who are becoming very hot, high temperatures, losing more than 10% of the weight in the first week of life. Now that's dehydration and needs to be tackled very importantly in babies. And coming to infections like conjunctivitis, pustules, umbilical sepsis, of course, I'm sure you all are very well versed in checking these things and managing them appropriately. Excessive crying, most likely due to colic, but this comes after 3rd week, up to 3 months. Colic never comes in the first 2 weeks of life. Most likely it's a late thing, after 3 weeks. And most likely these babies always get a colicate drops wherever they go, and then that becomes a norm for these babies. But always excessive crying might not always be colic, so we have to remember that. Evening colic, like I said, it's most commonly after 3 weeks, up to 3 months, wherein the baby is tensing the tummy, lifting the legs and crying, not settling down after feeding, most commonly. And then you like to put them prone. Prone position really helps them, right? and then these babies generally do well thereafter. Eating ajwain and all that, I think it's followed everywhere, but I don't know how far it's good. Breath holding spells, choking episodes, excessive sleepiness, these are all things where babies need to be monitored. Normal findings, there are a bunch of normal findings in all babies. What we'll do is we'll just go through a few pictures and then I'll end my talk. So this is acrocyanosis, very common in babies, generally disappears, nothing to worry. Epstein pearls, Erythema toxicum, again whitish pearls in the palate, Erythema toxicum, reddish papillar, pustular vesicles, eruptions on the body, it generally moves and then they're generally better by 7 to 10 days. Melia and jaundice, of course, melia sebaceous ducts which are a bit kind of hypertrophied on the nose. Jaundice, of course, be very careful. If it is, I generally look at the Kramer's rule, phase 5, chest 10, 15 and then 20. Of course, that still holds good, but make sure you are not checking it in yellow light. Yeah, make sure you don't do that. Yeah. And the neonatal teeth, very common we have, and unless it's causing any problem in feeding or nipple issues, then we generally keep it or we remove it if necessary. Cutis marmorata changes, skin changes in babies. Skin is very, very immature, peels off. So better to use plain water, just a single oil after the 7 to 10 days of umbilical cord falling off. No use of too many baby products. Cradle cap, very common. Cap it, babies generally after a normal delivery with any kind of instrumentation come and cap it, and these babies generally do well and it resolves by 2 to 3 weeks. One delayed complication of cap it is jaundice. So they generally come back with higher jaundice levels after the 3rd week. Diaper rash, very common in babies. Of course, this is a pathological rash. You've got a little red nappy rash, nothing to worry. Just to make sure that you tell them that you use non-fragrant wipes rather than fragrant wipes, because these days there's a lot of marketing around wipes. So the moment they start using water wipes and clean from front to back in girls and keep that area clean and dry, okay, and if necessary apply a light bit of barrier like a Vaseline or a basic sort of pseudo cream or easy nappy cream, something pre change of nappy. It generally does well. Very common to have Mongolian spots, but if it increases in size and positions, then we'll have to think of pathological reasons. Phimosis, please do not try to push the prepuce back below 1 year of a child. Ideally, it's a very tight adherent prepuce, it will not come down very easily. So phimosis is very common, not to worry. Sacral dimple, if it is present longer, if it's present more than 2.5 centimeters from anal verge and you can't see the base, such dimples need to be evaluated by an ultrasound scan of the spine. If they are very small, present very close to the anal verge, they are generally normal, nothing to do. Stop bites are small cutaneous hemangiomas which generally disappear. Subconjunctival hemorrhages are very common after normal delivery, which again disappear in about 2 to 3 weeks. Umbilical granuloma, very common late findings by about 3 to 4 weeks, and then can stay up to 1 or 2 months, can cause a lot of anxiety in parents. Generally, local asepsis and salt cauterization generally helps in that area. And prominent xiphisternum is because of a compliant chest wall in babies, most likely it's normal. Any questions, please? Thank you.